Okay, so let's do this. What drugs are being used or being studied for prophylaxis of COVID-19? Here's a list. Which one is not? All these are being used or studied, clinicaltrials.org, except for one. Okay, gave you enough time. We'll review it. So if you look in Eastern Virginia Medical School, they actually listed this on the web: vitamin C, zinc, melatonin, vitamin D, famotidine as prophylaxis. It's interesting. We'll go over some of the studies. We won't go over the famotidine study. That's very fascinating, I believe. Mildly symptomatic patients at home, they throw in a little Plaquenil and ivermectin. Ivermectin is treatment actually in South America. Some of the countries there are using that as first line in high-risk patients. So the virus comes in. Here's the host cell, and this is endosomal entry. Okay, and this is how Plaquenil is potentially works. It blocks the endosomal enveloping, let's say, of the virus, and doesn't allow the virus to come in. Here is zinc. Zinc really would block the RNA-dependent RNA polymerase here, and it basically won't allow the virus to hijack the RNA and make its own replication. So you want to get the zinc into the cell. So Plaquenil potentially would block the viral entry, but you also need zinc to get in there. And these red triangles are ionophores, and you'll see quercetin is a medicine that is a ionophore. It allows the zinc. There are certain proteins that don't allow, sort of blocks the zinc from coming in, and these ionophores allow the bypassing of these blockers proteins and allows the zinc to come in, so it blocks the RNA-dependent RNA polymerase. Okay, so here's quercetin. It blocks endocytosis. Okay, and it also blocks viral genome transcription. That's the thought process. Okay, and this is an example of one study that's being done on prophylaxis treatment, COVID-50 participants. I think this is in Egypt. It's a flavanol, widely distributed in plants, I think blueberries. Here were some other medicines, levamisole. It's an anti-worm drug, pretty interesting. And inosin is some antiviral agent, cell-mediated immune processes. That's interesting. How about melatonin? Melatonin basically continues to decline in middle age, and older people produce negligible amounts of melatonin. And a proposed prophylactic protocol, which is actually being used in the hospitals for sedation as well, is 2 milligrams per day per adult at night. Another treatment is peginterferon lambda 1A, not peginterferon beta 1A, which is the treatment for multiple sclerosis. This is the treatment, I believe, for hepatitis C. Fascinating. To give interferon, which is an antiviral. And here is a treatment of interferon nasal drops prevention. This study was actually completed in China. I looked it up. And they looked at over 1,000 medical staff, high risk. And if you look at the 530 people who were directly exposed to COVID-19, none of them developed COVID, whereas the people in Hubei, you can see the number of confirmed cases. It was as high as 250, and the number in the nation was 130 healthcare workers before that. So that's an interesting concept. I reached out to the author, he never got back to me. Bromhexine is an example of some mucolytic drugs being used. As more symptomatic, but they're being combined with Plaquenil. I will, I will mention that it's not mentioned here, but mucomist, N-acetylcysteine, has been looked at as an antioxidant, and that probably has some promise with somebody who has persistent cough. So what would I recommend for prophylaxis? Just zinc, vitamin D. If you can get some Pepsid, I don't see how that could hurt, 20 to 40 milligrams a day or a week. And Plaquenil once a week. I mean, it makes sense, even though the University of Minnesota study was negative. That was very high dose. I'm not really sure. Or quercetin daily. That would be prophylaxis. What about early treatment? So you have zinc, 50 milligrams, Z-Pak 500 for 5 days. Everybody's going to be different, but if somebody has it who's high risk, I wouldn't say necessarily somebody who's less than 50 should do this. I'm just saying this is one approach for a high-risk patient. If heart condition or arrhythmia, then doxycycline, 100 milligrams POBID for about 7 to 10 days instead of a Z-Pak, Tylenol, PRN for fever, either Plaquenil or quercetin consideration, but I'd be wary to combine the Plaquenil with Z-Pak, even though many studies have shown that that's tolerated okay. Vitamin D, 5 to 10,000 a day. Vitamin C plus N-acetylcysteine. I would use the N-acetylcysteine if somebody was coughing. I certainly would use famotidine, 20 to 40 milligrams, because of some of the reports that patients in New York were better off, less likely to have worsening of symptoms if they were on Pepsid. If you had these HIV medicines, Prescobix or Kaletra, if you happen to have them available, I don't think that it would be harmful to take a few early on, just like you would if, God forbid, you were stuck with a needle of an HIV patient. You would take it for a few days, prophylaxis. I think it probably would help if you took it early on. All the studies that didn't really show benefit, that was after 14 days. Would consider 1 to 2 days of Valtrex as well early on. That is acyclovir. It shouldn't work, but it is in the same class as remdesivir, and you don't have pocket remdesivir in your house yet. And again, if you're high risk, and certainly if you can't make it to a hospital, this is something that people use over the counter actually for herpes. Colchicine daily 0.6 is an anti-inflammatory. These are treatments that I've seen used by various doctors and are not crazy. Ivermectin is a pill used for scabies, and it was published that there was some antiviral activity, but that's a very high dose, 14 milligrams. I'd be hesitant to use it. I know of a high-risk patient in Colombia who was on 40 milligrams a day for 5 days and tolerated it fine, but that's N equals 1. And then if it's high risk, if you can enroll in convalescent plasma early trial, that would be it. So this is just an interesting discussion, which is used or being studied for prophylaxis of COVID-19. So the answer is all of these except for PEG interferon beta. It's PEG interferon lambda. Thanks for listening.